I'm ready to go whenever. It's good? Okay. Cool. Hi, everybody. It's great to be here. Thank you so much for the invitation, Jordan. I appreciate I think this place is really such a blessing to the patients that have been here. Been in contact with a number of patients who've gotten the resources here. I'm a professor at University of South Florida, Morsani College of Medicine, and I teach medical students, I teach PhD students, masters, and honors undergrad. And I do about 50% of my time is research, and 50% of my time is teaching students. And then I also, outside of that, I do education outreach. So this event would be sort of under that bucket. I do research on nutrition, neuroscience, and physiology. And we also have the Hyperbaric Biomedical Research Lab. So that's what brought me here to Tampa, Florida, and USF specifically. Our lab is funded by the Office of Navy Research, Department of Defense, to understand hyperbaric oxygen, hyperbaric physiology. Specifically, the limitations of hyperbaric oxygen is oxygen toxicity. And that is a limitation for our Navy SEAL divers and the limitation of how high you can go with hyperbaric oxygen therapy. So the mitigation strategies that we test to make hyperbaric oxygen safer is a ketogenic diet or therapeutic ketosis. So today I'll be talking about ketone metabolic therapy, and under that umbrella would be a clinical ketogenic diet that's used for a wide variety of applications. Many people don't know there's almost a dozen randomized controlled trials on ketogenic diets, unlike other diets out there. And I'll go through the gist of what a ketogenic diet is. So I want to talk a little bit about the therapeutic applications of a ketogenic diet. Also, it's a very low carb diet. So if you're on a diet and you restrict carbohydrates low enough, then you achieve and sustain ketosis. And a lot of benefits come from doing that. So we're going to talk about achieving, sustaining, and also monitoring ketosis. So a ketogenic diet is unlike any diet that is out there because you have an objective biomarker that actually defines what the diet is. So that's your blood ketones. You can measure urine ketones, and you can measure breath ketones too in different devices I'll be talking about. And typically what happens is that when you follow a ketogenic diet, that vastly improves the cardiometabolic biomarkers that are associated with health and longevity. So we'll talk about what those biomarkers are and what to measure. And then I have resources, if you guys have any questions, I could send the PDF file of this presentation if you're interested. So our lab studies what I like to call ketogenic resilience in extreme environments. And we do this at the level of the cell, at the level of the mitochondria. We look at tissues, for example, brain tissues from different animal model systems. And we also simulate oxygen toxicity in a Navy dive with different rodent models. And when we induce therapeutic ketosis, that has a stronger anti-seizure neuroprotective effect than any anti-seizure drug that we know of. So we've established that and published it years ago. And then out of that research, then we've started studying many different things, including cancer, Alzheimer's disease, and inborn errors of metabolism. So we've moved the science of ketogenic therapies and ketone technologies into human randomized controlled trials. We do studies at Duke University, working with the military. We have surrogates for the Navy SEALs that get inside chambers, and we measure a lot of biomarkers, and we push them. We go much higher level of oxygen that's typically used therapeutically and maintain that until they have signs of oxygen toxicity seizures. And then we stop the hyperbaric oxygen, and then we mark that time point. And if you're in a state of ketosis, you can go many times longer. You can withstand hyperbaric oxygen, high oxygen, many times longer and get more therapeutic benefits from it. So I've lived in an underwater environment for up to 10 days on NASA's Extreme Environment Mission Operations, which is a space analog that they use to train astronauts. And working with astronauts, we vet out different equipment, techniques, and procedures that they then carry on to the International Space Station and ultimately the lunar surface and also Mars. So it's been a great opportunity to work with them in different environments. And then, like I mentioned, this is studies that we're doing at Duke. We submerge people. He is inside a very large hyperbaric chamber, and he's doing a simulator. So we're looking at cognitive function. We're looking at reaction time. We're looking at various biomarkers. We're measuring EEG in the brain activity. So what we have found, generally speaking, is that being in a state of therapeutic ketosis, which is what I'm going to talk about, improves cognition. It improves your resilience to extreme environments. It can be used to metabolically manage a whole range of different pathologies and different disorders. And what the innovation over the last 10 years is really the way that we get into ketosis. So traditionally, it's been a very strict ketogenic diet. So we have developed various ketone technologies at the University of South Florida, and we're applying them to military procedures. But I saw this as an opportunity to move the science into clinical application. And I'll cover some of the applications for that. But I got into ketogenic diets. I was kind of like a late adopter to this. So this was being studied. You could see Jim Abrams. He was a Hollywood producer that produced the movie Airplane, Naked Gun. You might be familiar with that. So his son Charlie had drug-resistant epilepsy, and he put his son on a ketogenic diet because he only found out about it when he went to the library, and he tried every drug you could think of, and he did not respond to drugs and had awful side effects from multi-drug therapy. And he put his son on a ketogenic diet, and remarkably, it cured his seizures. So Jim Abrams is friends with Meryl Streep. So Meryl Streep did a movie about the ketogenic diet. It's called First Do No Harm. So I became aware about this in 2007. And that inspired me to go down the path of drug research. I'm in a pharmacology department and physiology department, and I was studying mostly drugs, but I steered my research into nutritional therapies and have been pretty much involved. 90% of what I do is nutrition therapies for neurological disorders, cancer, and a wide range of inborn errors of metabolism. So if you're interested in learning more about sort of the roots of the ketogenic diet, I would recommend going to the Charlie Foundation, and I work with them closely on educational content. I incorporated the Charlie Foundation in a TEDx talk that was done more than 10 years ago in Tampa Bay, and just kind of the overview of the history of the ketogenic diet. So 10 years ago, if you went onto clinicaltrials.gov, which is all the clinical trials that's being done on any drug, you need to register it on a government website called clinicaltrials.gov. 10 years ago, there was less than 10 registered clinical trials with using a ketogenic diet as the therapeutic intervention. So if you go on clinicaltrials.gov now, there has been an explosion of research on different things, including, you can see there's 498 registered trials on a ketogenic diet. So there has been an explosion for a wide variety of research. I think we realize that nutritional therapies are a huge lever in improving our health and well-being. And I teach medical students, and we have a functional medicine group within the medical school program, and they are more interested in what's being done here than the conventional medical training so there's an expanding number of medical students that really want to incorporate this stuff into their actual practice. And I've had students go into plastic surgery, orthopedic surgery, family medicine, it doesn't matter what. So the techniques, a ketogenic diet and various things that I'm talking about have applications across a range of different disciplines. So these are the different evidence-based applications, and there's emerging applications for the use of ketogenic diets. And I just want to highlight autoimmune disorders is one of them. Ulcerative colitis and Crohn's, the data is very early on this, so and the research is just emerging on that. But epilepsy, seizure disorders, Alzheimer's disease, Parkinson's, cancer, and the number in parentheses is the number of actual clinical trials that is being done now. So when these trials are done, they will become peer-reviewed publications, and it'll help us understand, the efficacy of ketogenic diets for these disorders. My concern with some of the trials is that everybody's using a different kind of ketogenic diet, right? So I'm part of different working groups to define and standardize what a ketogenic diet is. And I think a ketogenic diet should be defined by the elevation and sustainment of ketones, because the ketones are that therapeutic molecule. And a lot of people running these trials don't measure ketones. So it's really important to measure the levels of ketones to ensure that the diet or supplement is achieving that therapeutic level. So another area that I'm very active in is psychiatric disorders. So that includes schizophrenia, bipolar, depression, anxiety. Anorexia nervosa actually is a psychiatric disorder that kills more people than any other psychiatric disorder. So I have colleagues that work three different investigators studying ketogenic diets for something like anorexia nervosa. So 10 years ago, this was unheard of. So it just gives you an idea of the emerging research in this field. So even chronic obstructive pulmonary disease, alcohol withdrawal syndrome. I just finished being a student mentor for someone studying alcohol withdrawal syndrome and also benzodiazepine withdrawal syndrome. Very common benzodiazepine drugs. Going on a ketogenic diet can significantly mitigate the withdrawal symptoms coming off of alcohol and benzodiazepine drugs. So there's an emerging application of ketogenic diets. So there are different ways that we can achieve and maintain ketosis. So the ketogenic diet was developed and used clinically, developed at the Mayo Clinic in 1921 by Wilder. And he developed this diet that was 90% fat and like very restricted in protein and essentially no carbohydrates. So it's important to know that there's many different versions of ketogenic diets out there. There's like the clinical ketogenic diet and like internet keto, which is like internet keto is kind of like under 50 grams of carbs. So that would be like a very loose ketogenic diet. But once you drop carbs down to about 25 grams per day, total carbs, then you start to achieve therapeutic. But you can incorporate different fats into your ketogenic diet meals, including medium chain triglyceride or MCT. So MCT oil you could buy on Amazon, you could buy at Walgreens, CVS, Walmart, Publix has MCT oil. So when you consume MCT oil, it goes to your liver and about 30% of it becomes ketones. And then the MCT can also cross the blood-brain barrier and be a source of energy for your brain. So you could achieve therapeutic ketosis with intermittent fasting. I forgot to talk about intermittent fasting, also called time-restricted feeding. That's essentially eating within a window that's, it could be 12 hours, but ideally like 8 to 6 hours, eating in a 6-hour window. The time that you're not eating, you achieve a mild state of ketosis. So if you're to do that and then follow a low-carb diet or ketogenic diet supplemented with MCT, and then you could further augment the therapeutic effects of the ketogenic diet, even independent of carbohydrate restriction, with ketone supplementation. So that can be achieved with a ketone salt. So that's KetoStart. That's the product out there. It's basically taking the ketone molecule and combining it with electrolytes, which are really important for hydration, detoxification, especially sodium, magnesium, calcium. These things are really important. There's ketone esters, and we do research with ketone esters and ketone salts and MCT, and some of them are pretty powerful. The ketone esters and the 1,3-butanediol, they have a lot of the market, and I would encourage people to shy away from them because they taste bad, they're expensive, and if you consume them high doses over time, they could stress your liver. So the ketone salts or ketone electrolytes like KetoStart are just simply the ketones with electrolytes. So that's what I would recommend. So we know that ketones then are produced in the liver. If you take exogenous ketones, they enter circulation. And the ketone molecules then are very powerful energy sources for your heart, for your brain, and other tissues. And then what we study in the lab, we focus a lot of time and effort looking at the different signaling molecules, signaling properties of ketones. So ketones actually have they influence gene expression. So we say they have epigenetic effects. They have anti-inflammatory effects. if you elevate ketones to the level of 2 or 3 millimolar, it's like taking ibuprofen. So it inhibits the COX-2 enzyme. So it actually has anti-inflammatory effects. There's a ketone receptor, and when that's activated, it activates an anti-inflammatory pathway. It Not to get too technical, but it suppresses something called the NLRP3 inflammasome. That when the NLRP3 inflammasome is activated, that's the trigger for autoimmune disorders. So if you have ulcerative colitis, any type of autoimmune disorder is typically associated with hyperactivation of this inflammasome complex. And we were part of a Nature Medicine study, a paper where I designed the diet, and it showed very specific suppression of this inflammasome, that when that inflammasome is activated, it increases things like IL-1 beta, TNF alpha, and then the ketones, pharmacologically even, it's an endogenous metabolite that we can consume in a supplement, actually suppresses that. So it has a wide variety of different applications. So it's really important to do, and this could be done at home. There's commercially available technologies out there that allow you to measure glucose, a glucometer, right, or a continuous glucose monitor you wear on the back of your arm. But this is also emerging for ketones. So there are commercial meters out there that will measure glucose and ketones with a finger prick. But now there's technology emerging that's out there now. It'll be available pretty soon, where you can continuously measure glucose, ketones, lactate, and a whole host of other biomarkers. So you could look at your phone and get real-time metabolomics. So this is being developed by different companies. I work with Levels Health. The founder was Dr. Casey Means. She's got a new book out called Good Energy. Great book, I highly recommend. And also Josh Clemente, who worked with Elon Musk. So he worked on the life support system. So Josh and Casey came together. They brought me on, and I'm an advisor for like the different metabolites that they're working on creating sensor technology for. So we'll have the ability to measure in real time the effects of the ketogenic diet or other types of diets. So we specifically study therapeutic ketosis, but a wide variety of diets, could be monitored with this technology. So in the middle here, we have a person that I know has type 1 diabetes, and the top graph is 1 week of his continuous glucose monitor data, showing his glucose shooting up to 300, 400 milligrams per deciliter. If that was to happen over the course of 10 years, that would cause tremendous damage to the brain, to the heart, to the endothelium, your blood vessels. So when he adopted a low-carb ketogenic diet, that's the data 1 week after following, that's each day. The line represents each day. You can see it's totally flat. So there's no glycemic spikes that also trigger a release of insulin. He works very closely with a group called Type 1 Grit on Facebook. And then that group is so adamant about recording their data. That data was then published in a Harvard study. It was like a social clinical trial where they were able to collect the data, de-identify it, and basically show that even with type 1 diabetes, because he has type 1 diabetes, that he could decrease his insulin. Whenever you could decrease the amount of insulin you're using for type 1 diabetes, like any endocrinologist would say that's a good thing. And ketogenic diets, low carb diets, it doesn't even have to be ketogenic, is one way to achieve that. So I wear a continuous glucose monitor. There are a lot of foods out there that are keto, right? So I went to Publix and got Catalina Crunch, I think, cereal that is marked like keto. But when I ate it, here is my glucose response to eating Catalina Crunch. It actually spiked me like 50 milligrams per deciliter. It was like eating like a cookie, essentially. So my warning is that when you go on a ketogenic diet, there's a lot of processed foods out there that are marked keto, and they're processed food. It's sort of like the information that you're getting here on nutrition, listen to it. So if it's not found in nature, avoid it as much as possible, right? So single source whole food ingredients, that should be like 80% of the foundation of your diet. And this just simply doing that, and it could be it could be a sweet potato, it could be vegetables or whatever. That'll cure like 90% of, what's bothering most people. So blood biomarkers are also really important to measure. Most people are told to do like a comprehensive, blood work once a year. Your insurance covers it, but it typically does not include the most important metabolic biomarker is insulin. So that's really tells the whole story. So you want to do insulin. I'm a huge fan of looking at other inflammatory markers, but high sensitivity C-reactive protein is super important. Hemoglobin A1C, triglycerides, and vitamin B12 is also, I see that come out as low on many. Yes, is there a question? Mm-hmm. Yeah. Yeah, that's what I'm mentioning here. Yeah. Uh-huh. Oh, the units. Yeah, the yeah. And that's normal. Yeah, I know. Yeah, yeah. Yes. Yes. Yep. Thank you for pointing that out. So the underlined thing, that's like where we want to go. That's like ideal. That's what we're shooting for. I would say 90% of people, maybe even more, don't have an insulin level that low unless you're doing some form of carbohydrate restriction. Although, I communicate with athletes that are fully just they're carb fueled athletes and they have insulin levels of 4 or 5, but they are another end of the spectrum. So yeah, so the underlined numbers here are the numbers that we really want to shoot for. I was on a fairly higher carb diet maybe about 15 years ago, and my HSCRP was always like 2 or 3. Now it's 0.1 or non-detectable on most tests. So the lower HSCRP, the lower, and that's for me. I think that's a potential dairy for me, or a lot of nuts. I think feel is an autoimmune trigger. If I eat a lot of dairy, I start to get stuffy and things like that. So HSCRP is a good sort of broad indicator of that. Hemoglobin A1C is good, but if you're wearing a continuous glucose monitor, that average glucose is a direct measurement versus an aggregate measurement, which would be hemoglobin A1C, which takes the aggregate blood glucose over, at least a 3-week period of time. So, and then triglycerides, I think, are a really good indicator if your body is burning fat. So if you go in for fasted blood work and your triglycerides are 100 or over, your body is not, you have poor metabolic flexibility. Your body is probably favoring glucose for fuel. And the more we do things like carbohydrate restriction, just taking out, any kind of added sugar, reducing processed carbohydrates will start to get your body fat adapted. Protein, veggies, healthy fats, that should be like the cornerstone of your diet. And B12 is also super important too. The Alzheimer's Clinic at University of South Florida, the Bird Alzheimer's Clinic, one of the first things that they do when they test a person is look for B12 deficiency, because B12 deficiency will literally show up as like Alzheimer's pathology from a behavioral perspective. It will cause your brain to shrink. It'll cause your hippocampus. It's an area of your brain for learning and memory to atrophy. So this could actually be reversed in some patients. They usually need an injection of B12, but it's something to look at. And I've seen it more and more on blood work. So if you're interested too, you could do more advanced testing. I work with different companies. ZRT Labs is great. I've been using them since 1990. Cyfox, Genova Diagnostics. So this is a Genova test, I think, where I can look at, you could do a whole metabolomic profile. They take your blood, urine, and saliva, and that all is done from home. It goes to the lab, and they look at your metabolic profile. I had a red flag for butyric acid, beta OH butyric acid. That's ketones, right? So that's a good thing. On their test, they didn't know I was on a ketogenic diet, so it flagged it as something out of range. But my lactate was low, or lactic acid was low, and they do omega-3 fatty acid content in your blood is super important. So there's the omega quant test. They could do a lipidomic profile. You want to make sure that your trans fatty acids are low and that your omega-6 fatty acid profile is low relative to omega-3. And also it looks at toxic elements. So I recommend that. I did this test right after coming back from the Dominican Republic, where I was eating 2 or 3 pounds of fish a day that was caught locally. So I was going to see, are my heavy metals elevated? Because I also eat a lot of sardines. Came back, did the test, and then my heavy metals were low, and that's great, but the bismuth was high because I did pick up a little stomach bug, and I took a little bit of Pepto-Bismol. So I was like, what is bismuth? So I started researching it, and that's a component of Pepto-Bismol. So it's so sensitive that it was able to pick up a dose of Pepto-Bismol I had like a week ago. So some of these tests are really accurate. So so the takeaways then, I want to leave enough time for Q&A, is that there are many emerging applications of ketogenic metabolic therapy. It's accepted with pediatric epilepsy. We have randomized controlled trials also for adult epilepsy and other seizure disorders. Therapeutic ketosis shifts brain energy. So your brain has the metabolic flexibility to adapt from using glucose to using ketone bodies for energy. And this happens during fasting. If it didn't happen during fasting, we would catabolize skeletal muscle to liberate the glucose, and we would quickly waste away. So ketones have a muscle-sparing anti-catabolic effect. Self-monitoring and biomarker tracking are absolutely essential, because the more, I've seen this over and over again, and it was mentioned here today, the more a patient educates themselves on the actual diet therapy and does proactively gets involved in their own care by measuring these biomarkers, the more, the higher compliance they have to the diet and the more success they're going to have for this. So I think tracking vitamin D, magnesium, body composition, just looking at body composition might actually be one of the best biomarkers. So I think it's wherever your starting point is at, the point is to improve upon that, and your metabolic health will improve from wherever you take a baseline. And that could be an in-body 570. I do a DEXA scan every year. That could be scale weight, BMI. So I think it's just important to, it's something that you measure, and then every year you try to beat that. You try to beat your body composition. Strength, surprisingly, grip strength is like one of the most, in research, it's one of the best biomarkers for health and longevity, believe it or not. Sleep, I could do a whole talk on sleep, but I think it's super important. There's wearable technologies out there that could be an Apple Watch, a Fitbit, it could be an Oura Ring. All these are great devices. We've used the Oura Ring in our research with NASA, and it was very effective for capturing not only the total sleep time, but also sleep architecture, from deep sleep to REM sleep. And so this is all really important. I'd like to thank my beautiful wife, because she has moved the science of ketones into application with the KetoStart products, the beta-hydroxybutyrate supplements you'll find out there. And all the students, medical students, postdocs, undergrads that work in the lab, they do a lot of the research that we publish in the lab, and I just kind of oversee it all. We do have a podcast. We have a conference called the Metabolic Health Summit. We held it in Clearwater less than a year ago. We had about 1,000 people there, and we have an online ACC accredited medical education platform. So doctors interested in actually getting medical education can go to Metabolic Health Summit .com or Metabolic Health Initiative, and then we have tracks of neuroscience, cancer biology, metabolic disorders, where you can get ACCME accredited content or medical education content. And then we typically bring those speakers into the Metabolic Link podcast. So we have free content, and then you can pay for content if you want to get medical education credits. Yeah, I think and we've had a lot of speakers you might be familiar with, like Rhonda Patrick, for example. I've learned a lot from her. And yeah, we've had a lot of speakers that you'll find. Many of them have podcasts, and a lot of that content is free online. So, and then a lot of resources here to just support some of the science of what I'm talking about here, but free now to answer any questions that you guys have. Thank you so much for coming out today. You guys are investing in your health. Your health is your greatest asset. I often meet people that work really hard, maybe as a CEO or company, and they've worked hard, for decades, but their health they've focused so much on their careers, and then they get to a point, in their 40s, 50s, and 60s, and then their health just kind of fall apart. But I think it's really important to mention that health is really the greatest asset that we need to deposit into as early as possible to maintain our metabolic health in particular. So if you guys have any questions, just black shirt. Yep.
My daughter, and she has seizures, and so currently she's on medication for it.
Mhm.
They're focal seizures. I know that there's been talk about the ketogenic diet and um, drug-resistant issues. Would
Yep.
this still be beneficial even though she's currently?
Yeah. Is she on like
She's on
Capra?
Altium. Yeah, she's on Altium.
Okay. Yeah. So ketogenic diets too are kind of synergistic with certain anti-epileptic drugs. I went to Belgium to UCP Pharmaceuticals, and then even a mild low carb diet with Keppra, actually enhances the effect of Keppra, and it actually helps it cross the blood-brain barrier and all that. So it would be, if there's no side effects, it's typically used for drug refractory or drug resistant epilepsy, but some functional medicine doctors and more people that think outside the box, it's like, well, let's use nutrition before drugs. So we do know that a ketogenic diet is more effective than any anti-epileptic drug because it works when drugs fail. And then if you follow that diet, it does have side effects though, clinically. So I think there could be an opportunity to drop the dose or get rid of the drug altogether, because sometimes the anti-epileptic drugs, you don't get side effects now, but later on, including autoimmune. I have a friend now that he can't tolerate anything, so he has to be on, his system is so, and it affected his endocrine system that his hormones are forever messed up from these anti-epileptic drugs. So.
And I think that's my concern. I do give her MCT oil,
Mm-hmm.
and
Yeah,
this is
yeah, it's hard.
but I was just making sure that how can I best support her liver, and is the MCT
Yeah.
oil enough? And so I think that was just my main concern.
A low carb Mediterranean diet with supplementation could be all that's needed. Maybe try that first, but she's 14 and that's a hard. So when it's younger, the kids just eat what the parents give them, but 14 is that age. But the Charlie Foundation, great website for information. Yep.
Yeah, just one little
Mm-hmm.
plug with getting in full blown ketosis is not easy. And I did like 10 years ago, I did a lot of ketosis, and honestly, probably the best I've ever felt. But getting all those fats can be a little difficult. But eating a lower carb diet and then just supplementing with the ketones to me was a lot better, 10 times easier. So just a little plug.
Yeah.
Your wife has that company outside they're kind of displaying. So for me in the past, that worked out. Like you said, Mediterranean diet with the supplementation.
A low carb Mediterranean diet, so you get all the benefits of low glucose, low insulin, low inflammation, and then they get the benefits of ketones. You could take MCT oil or ketone salts, which taste great, and small doses of them for the anti-inflammatory effects. So the ketone salts have beta hydroxybutyrate, which is metabolized the same as butyrate in the gut. So it's very good for your colonocytes. It's very good for gut health, gut repair in general. So there's actually a very robust area of research right now is ketones for gut health and autoimmune, because it prevents intestinal permeability and increases akkermansia, which creates like a mucus lining between there. So it actually makes your gut less permeable and can help with autoimmune disorders. So there was a recent paper that just came out in Nature. I wanted to put it in my slides, but I didn't have time.
Yeah, one more question.
Yep.
I have two.
Okay.
Just okay. Let's see. Are you doing any studies at this time?
Yes, we're doing. I'm working with Levels Health, and I'm the principal investigator on a study with 15,000 subjects that we're monitoring their glucose levels, but they're putting lifestyle data in there. So their dietary pattern, that could be vegan, it could be Mediterranean or keto, but they're also event marking their food.